Hello everyone, welcome to Nurse Pro. The purpose of this channel is to help you all to pass your OSCE. Today, our topic is subcutaneous injection. It is one of the OSCE skill station. So this channel is just for sharing, and you can choose your own words and arrange your own sequence to do your task. So this is just a recommendation for all of you, and I hope you can remember the steps more easily. And remember, you need to check the latest marking scheme because the NMC may update the marking scheme every few months, so there may be new points added to the marking scheme. Make sure you know that. Please refer to the video of OSCE framework because it gives a general idea of what we should do during the whole procedure. In this video, I just focus on the subcutaneous injection, the main points. So for the general steps, please refer to the framework video. But I will go through it quickly. So after you start, the first thing is, before you approach your patient, you need to ensure that the environment is clean and it is clutter-free. No obstacles is on the floor. And then you need to maintain privacy and dignity. You close the curtain if you are in the hospital, or you close the door if you are at patient's home. And you need to perform hand hygiene with 7 steps according to WHO guidelines, especially if you are doing the first time to show to examiner. And then you approach your patients, you greet your patients, you do the self-introduction, and then you need to ask the patients, how should I address you? How do you like to be called? And then you use a short sentence to state the aim of coming. Let the patients have an initial idea that why the nurse is coming today. And then I will suggest you to check the identity as soon as possible. Because if you fail to check it, you fail the task. You didn't ensure that it is the correct patients that you need. So, and also this is a skill station for medication, so identity is 100% important. If you're in the hospital, please check the full name, date of birth, and hospital number. If you're in the community, check the name, dates of birth, and full address. Then you check the allergy. And then you need to restate the aim, you give more information to your patients, and you gain consent to proceed the procedure. And then you check comfort. You need to make sure the patient is comfortable with its position. You need to ensure the patient is having the correct position for your procedure. And also you need to ensure that the patient is physically and psychologically ready for your procedure. And then after you prepared all this, you leave the patient, you give a call bell, of course. And then you leave the patient and then you prepare for the task. Subcutaneous injection is one of the skill stations and it lasts for 12 minutes. And positioning is important. It depends on which area that you are going to inject the subcutaneous medication. You need to wear apron and a pair of non-sterile gloves. So you need to explain the reason for the subcutaneous injection. So you may tell your patient, the doctor has prescribed this medication for example, has prescribed insulin for your diabetes, for your high blood sugar level, something like that. So I'm here to give you the 12 o'clock subcutaneous medication. It will be given to your fat tissue layer. Also, you need to tell the patients the site preference. So it is recommended to be injected at the tummy. But there are other areas that patients can choose, for example, the upper arm, the middle thigh. So the patients got the right to choose. And also you can ask the area that patients received the medication last time. Then you could do some site rotation to avoid the medication to be given at the same area. And then you need to check comfort. You need to ensure the patient is comfortable with this position. Okay? After you leave your patient, you need to read aloud the whole prescription. The 5 rights: right patient, right drug, right dose, right date, time and frequency, and right route. If you read aloud the whole prescription, the prescription table actually got all these things. And make sure you need to check the allergy because you're doing a station of administrating medication, so allergy is very important. For example, you are given a scenario like this. ABC has been prescribed with subcutaneous atropine. Date is today, time is 8 o'clock. You need to read aloud the whole table. Patient's name, ABC, date of birth, blah blah blah, address, blah blah blah. And the patient is allergic to blah blah blah. And then the drug name is atropine. Dosage is 40 international units. And the route is subcutaneous. The date is today, time is 8 o'clock. And then prescribed by Dr. XYZ today, not yet given. Because you see the right hand side, the box is empty, nothing is written down, so due to be given now and not yet given. Okay, so besides you check the 5 rates, make sure that you ensure the prescription is valid, complete and eligible. So we've just checked the prescriber name, our signature is here, the prescription date is here, not yet given. If you are given the bib number and the GP number as well, please read aloud. And then you conclude that the prescription is complete, valid and eligible. And then you go to prepare your equipment. Make sure your tray is clean, and then you need to get the medication. You check the drug name, so make sure it's the correct drug, and you need to check the package is dry, intact and undamaged. You need to check the expiry date. It's in date, not yet expired. You need to check the solution inside the medication, the vial or the ampoule. It's clear without precipitate. You need to get an insulin syringe or the subcutaneous syringe. And you need to aware that there may be 2 markings on your syringe. One is mil and the other is units. So you need to see when you are withdrawing mil, then you check the mil slider. When you are withdrawing international units, then you check the international scale, okay? For this insulin syringe, you can see that you got a orange cap. So you can remove it and then you draw the medication that you need and then you recap it. And then after your injection, there is a white part here. You need to slide it upwards so that like the picture showing you, so that you won't be hurt by the needle. After that, you need to get the alcohol webs, and then you need to prepare the gauze, plaster and sharpboards. Then you need to prepare the drug. First, you do hand hygiene, remember? And then number 2, you use alcohol swab to disinfect the ampoule and vial. Whenever you withdraw some liquids from an ampoule, vial or the saline solution, you need to clean the opening first. Clean it with alcohol swab for 30 seconds and then let it dry for 30 seconds. After that, number 3, you break the ampoule with a gauze if it is an ampoule. If it's vial, then it's okay, you just need to clean the superficial opening. And then number 4, you aspirate the accurate amount. You need to calculate. You need to do some calculation according to the prescription and how many mil, how many units you need to check, alright? And then number 5, after you withdraw the accurate amount, you need to recap it, but make sure that you use the single hand re-scope technique. You just use one hand to avoid any needle stick injury. And then number 6, you need to ensure that it is the accurate amount, and also you need to ensure that there is no bubbles. After that, you show the syringe to your examiner. He will come to have a look to check if the amount is correct. And then number 9, you place the syringe on your tray. Then you are going to return to your patient. Remember, hand hygiene. And then you wear your apron and then you will need to prepare a pair of gloves. So because after you return your patient, you are not giving the subcutaneous injection immediately. You still got something to do and you need to check the site. Therefore, you prepare a pair of gloves to prevent contamination of your gloves. But if you can ensure that you won't touch anything, you won't contaminate your gloves, you can wear your gloves at this moment. So it's really your own preference. And then when you're back to your patient, you gain the consent to proceed, and also you've left your patients for a while, make sure you need to recheck. You need to double check the identity of patients. We don't want any medication error. And then you need to check the allergy again. And then you can use this moment, you can grab the moments to explain the effects and side effects of the medication. There are some common medication that will be given for subcutaneous injection, such as dalteparin, enoxaparin, and insulin. So you better prepare the effects and side effects before your examination. And then you can explain to the patients during the task. So just before the injection, you need to check the injection site. You need to read aloud this sentence. There is no signs of edema, inflammation, infection, skin lesion, and wound. So you ensure the site is suitable for you to give the subcutaneous injection. And then you do the hand hygiene and you wear your gloves. So now you're going to inject the medication. You need to do site disinfection. But for subcutaneous injection, it is written down on the marking scheme that if the site is clean and if the patient is not immunocompromised, you do not have to clean with alcohol. You still need to prepare the alcohol swabs because you don't know if the site is clean. You don't know if the patient is immunocompromised. But before you inject, you need to ensure these two. You need to see the site. Remember, you just finished the site inspection. And then you need to know if the patient is immunocompromised. If the question paper gives you all the answer, patient is not immunocompromised, that will be fine. If not, please ask. Please ask the patient, what other disease do you have? Or are you immunocompromised? Something like that. Then you can confirm that the patient is not immunocompromised and the site is clean, then no need to clean it with alcohol. Please read it out, explain it, you know every step that you are doing. And then you need to prepare for injection. Number 2, you need to remove the needle shield. And then number 3, you gently pinch skin into a fold with your non-dominant hand. Number 4, you inject the needle at degree angle. At which degree angle depends on what types of medication that you are giving. If you are giving insulin, remember 90 degree. Remember 19 degree. If you are giving medication other than insulin, remember 45 degree. At 45 degree, okay? So you need to remember all this. And then number 5, after you insert the needle, you release the grab the skin. And then number 6, you inject slowly over 10 to 30 seconds. You need to know you need to inject it slowly for 10 to 30 seconds. But because during the exam you are running out of time, right? So at least 10 seconds, remember. And then number 7, withdraw the needle rapidly. And then you discard the sharps in the sharp bin. And then number 9, you use some gentle pressure with the sterile gauze. And then you make sure not to massage the injection site. And then maybe you wait for a few seconds and then you remove the gauze and then you can report to the examiner that there's no bleeding. So plaster is not needed actually, but you should bring it in case your patient would like a plaster. Then you get it ready first, okay? And then number 12, you dispose the waste and then do the hand hygiene. After you finish all the steps, remember document as soon as possible. You sign the record, sign the medication record. If you are asked to write the date and time, please remember to write it. If there is a table asked you to write this administrator name, please write it. And then if there are other space, then you can document the sites that you have given the injection. So that your colleague next time they can refer to your words here and then they can do some site rotation. After that, you reassure your patient and ensure the patient is comfortable after the procedure. And you need to remind the patients that not to rub the injection sites. So this is the medication record. Remember to sign the right box. Okay, so you are going to end this section. You are going to leave your patient. Make sure you give a call bell if the patient is in the hospital. And you need to ask the patient to go to the GP if you are in the community setting. Okay, and also ask the patients to go to the emergency department in case of emergency. Also, you need to do proper waste disposal with hand hygiene, and you need to clean the equipment. You may state it out. You can say, I will clean the tray with alcohol wipes, and make it ready for next use. But these are all the steps you need to show to your examiner that you are prioritizing people, practicing effectively, preserving safety, and promoting professionalism and trust. So this is the end of the sharing of the subcutaneous injection. Remember, you need to memorize all the steps. You need to know the reason that you are giving the medication. And for example, if you are giving insulin, ensure that you have checked patient's blood sugar level. It is very important. And also, you need to know if the patient has eaten anything. If you give the patient insulin, but the patient refuses the diet, it is totally wrong. So if you are giving insulin, please check blood sugar level and patient's food intake, alright? And also, you need to know the angle that you are giving your medication. For insulin, 19-degree angle. For medication other than insulin, we give it at a 45 angle, okay? And also, you need to inject it slowly, 10 to 30 seconds. And you do not have to wait for another 10 seconds. You just need to inject it slowly. And then also, you do not need to do the site preparation by using the alcohol swab if the patient is not immunocompromised and if the site is clean. So remember all this. And also, after the injection, plaster is not necessary unless the patient requests it. Okay? So I hope you find these videos useful. Please like this video and subscribe to the channel. Hope to see you next time and hope you all pass your OSCE easily. Bye!